Good day, everybody. I'm Dr. Sage Wolfe, and I'm out here in Bonita Springs, Florida. We are just finishing up the New World Practitioner training. We're starting off with the Whole Life Coach, and then we'll be feeding into my course, which is the Wolfe Non-Surgical. And I'm out here with my buddy Jack, and Jack is here for some treatment. He came out for a couple days, and I just want him to tell a little bit of his story and kind of what happened to him and why he came out here and what his options were prior to this.
So I've been following them for a few years now, and about 3 months ago I was at a stop at a red light and I got rear-ended between 50 and 60 miles an hour. I was hit. I was with my buddy. He went to the hospital. I didn't. I got an MRI and they said I had 4 herniated discs in my neck, and the pain just got worse and worse and never got any better, and it started messing with my nerves as well. And I knew I just had to do something other than surgery. I knew I had to come here. The chiropractor and the lawyers and these doctors and everyone were saying the same thing. You got to get surgery. You got to get surgery. And they said it'll be okay. You'll get prescription drugs to take away the pain. And I do not want to get cut open. But anyways, I came here and he used the non-surgical treatment on my neck with his elbow. Used the Celsonic before and after that, and I could tell something happened, but I wasn't sure because my neck was so sore from the first day. The third day, I got all of my momentum back in my neck. I could actually move it, and all of the pain was just completely gone as of today. Today being the third day. All of the pain that I had before I came here in my neck is just completely gone now.
And so, like, this is just, like, small stuff that, like, not small stuff for him. Like, that's a very big issue. Like, I can even tell as he's explaining the story, as the doctors were kind of making him feel that, like, surgery is his only option. His hands start rubbing, he gets a little nervous because they put you in a position of where you don't have power, where you are going to be debilitated, where it's pretty much do or die. And we don't want to let our bodies go. God doesn't make junk. We allow it to become a cesspool. We allow our minds and our bodies to kind of come together as one and really start to bring us down. Because the world isn't really like a happy-go-lucky place majority of the time. There's going to be stresses coming from our friends, our family, the outside world, the government, financial status. It doesn't matter. But the thing is, we allow all this cluster to come in and these roadblocks to start causing this stagnation. And over that time, that stagnation will cause putrefaction and your body goes into contraction. And you can see Jack is a big guy. He works out. He should be healthy. But he's broken his body down so much to the degree, by breaking down, I mean like you've gone and you've done so much micro tearing to become the size he is. So we know that his muscles are already in contraction a bit. Eventually, it would have been one thing or another. The car accident was just the kind of straw that broke the camel's back, set him off, and now all this scar tissue that rooted in before had to go excess and kind of choke off more muscles, tendons, and ligaments, and even nerve endings, because that's what's in there. And so now when he goes to move and have that mobility that he thought he had, the discs are a little bit more compacted because there's more inflammation in there. And if we don't go in and we remove the fibrous tissue that has caused that to be so contracted, he's going to feel that forever. Or your last option should be surgery. That is in the emergency state. And so he wasn't in an emergency state. He's dealing with pain day in, day out. That sucks. But he did his research. He woke up. He rose to the occasion. He knew inside himself that he has a body that could heal. And he came to me and he trusted within me, which is a beautiful thing in itself, because it also is hard to give your confidence to somebody else to say, hey, can you truly help me? It takes a lot of confidence to truly ask for help, especially when it comes down to larger, big, broad men. Like, no, push through the pain, buffer it down, shut up, you can do this. No, it's not that. That's not it. We need to take a step back and honor ourselves. And he honored himself by coming out here. It was the first time you ever hopped on a plane in your life.
Yeah, that was a big deal for me to get on a plane.
So it's all these like small, and we can call them small, but it's like large steps, but these are small baby steps that are helping imprint a better him. And so we're so glad to have him out here. He let me work on his neck, and he was only here for a short amount of time, so he's going to be coming back at the end of the month. We'll see where he is after we do our second treatment on him. But we did one thorough treatment, 2 cell-sonic sessions, and his nerve pain is gone. He has more mobility. He's not feeling that tension there anymore. And then the doctors and this is, since he was little, we'll talk about his chest a little bit. He had a little bit of his, like, so you have costal cartilage segments along your sternum here that attach your ribs to the sternum. And so one of those was set off a little bit, and it was causing his left pectoral tissue to be jolted out, and this large mass, and it felt like bone to him.
At least an inch or two. The one side stuck out at least an inch. It was very noticeable. Everyone throughout my life asked me what was wrong. It's very noticeable. And he worked on it with his elbow. And before he even hit it with the cell-sonic, I couldn't believe it. 90% of it was gone just with the first treatment. You said we're going to do 2.
We're going to do 2 to 3 treatments, because the thing is, we can help the body. I can make you feel better. But we all have weak links. Our bodies are not meant to live forever. So we got to go in lovingly and reverse that and say, no, there's a new sheriff in town. I am going to change the structure of this body back to its original state and make that area heal stronger than when it got injured in the first place. And so that's kind of where we went with it. And so we just wanted to hop on here and tell you that, guys, don't make surgery your first option. In emergency care, yes, it's necessary. I get it. You're in a car accident, you have a bone coming through the surface of the skin. I don't want to deal with that. Those guys are what that is for. But you know what? If you're able to kind of like get up, still walk around, you're living in pain, you don't need to live in pain anymore. There's things we can do, and that's why we teach these courses. That's why you go to Braveheart Nation and you see if we're in your area. You don't just take this course for yourself and like, you take it for maybe you have friends, maybe you have family, and that's normally where it needs to start, but you're doing it for yourself, because this world isn't the kindest place ever, but we can make it kind by doing these self-loving steps, by implementing different courses, different modalities, and different trainings to become a stronger you. So thanks for joining, everybody. Thanks for coming out, Jack, and trusting in us, and we'll see you in the next one, everyone.
Thank you.